You are listening to the 8% Nation podcast, created to help you become a top producer in the insurance industry. Enjoy the show.
Welcome to the 8% Nation podcast, where we're dedicated to helping you get into 8%. 92% of insurance agents fail. Brian Askins. What does that statistic mean to you? 92% of insurance agents fail. Is that number staggering to you? Or you've been in the industry forever.
I've been doing this for almost 30 years, and so the number is. I actually think it's a higher number than that, but it doesn't surprise me whatsoever.
Well, thank you so much for joining us. For those of you guys who don't know, we've got Brian Askins with us today. You've been in the insurance world for 30 years, and this is Cody's father. So, Cody obviously has had him at 8% and done other, videos, but this is the first time we've invited Brian to be a part of the podcast. So we're just going to kind of unpack some things regarding Medicare. That seems to be the hot topic right now, obviously coming into AEP. You are, the granddaddy of it all in terms of just the patriarch of this organization over here that you guys have built. It's been amazing to be a part of for the last 4 or 5 months, and I'm looking forward to unpacking and picking your brain a little bit, man. Absolutely. So first, I would like to, would you mind just kind of telling the people a little bit about your journey, when you started, and I'd like since this is all Cody's audience, I'd love for you to add in, and then we had Cody, here at this point I was pre-Cody, post-Cody, like give me the whole story, man.
Well, I started the insurance business in April of 1990, and Cody was born in July of 1990. So,
okay.
So just 3 months later, and so he's obviously never not been in the insurance business, in some way.
Yeah.
And so I spent 7 years with Reliable Life Insurance Company. I spent 17 years with Mutual of Omaha. And then in February of 2014, I started my own insurance agency called Secure Insurance Group, and we're an independent agency located out of Springfield, Missouri.
Okay. And so what all products have you sold?
We do everything. The products that I focus on mostly, first product is Medicare, second is life insurance, and then the third is annuities. But we also do a lot of health insurance, hospital indemnities, a lot of extra products, payroll deduction, things of that nature. But the products we sell mostly, number one is Medicare, number two is life insurance, and life insurance would constitute also the final expense.
What'd you start selling insurance?
Final expense life insurance. Reliable Life. For 7 years, I ran a debit route.
Oh yeah.
And so each and every month, I would go by and collect each person's premiums, at their door.
Very productive, I'm guessing.
Yes, and yeah, and so I used to collect 465 homes, each month, and so you'd have to, you obviously you learn all your clients' work schedules and when they're home, when they're not home, when they get paid. Things of that nature, so you can make as few trips as possible.
Sheesh.
Trying to catch them and for them to make their premium payments, and it was quite interesting for 7 years. I tell you what, it probably taught me more than anything. It taught me referrals.
Okay.
And I'm not good at many things in life, but I'm pretty good at getting referrals.
Yeah.
That's where my business is at now. I get a lot of referrals every calendar year, and that debit route taught me that, just because I'm always in the homes and I was getting a chance to visit with people. So
that's awesome. So started with final expense, and then did you kind of go straight into just life insurance and then get into Medicare, or what was your sort of journey of products?
Yeah. So after 7 years at Reliable, I went to Mutual Omaha, and Mutual was big into the Medicare world.
Okay.
And so that's where I got into that really in 1997. So ever since 97, and our agency at Mutual was always the number one Medicare supplement producing agency in the company. When I took over the agency in 2010, until I left in 2014, I took over the agency in 2000 till I left in 2014. We were always the number one agency.
Yeah, Cody's told that story often, where you came in. I think you were the highest producing region in the country, and
we were always one or two for total production, but we were always one in Medicare every single time. So,
what do you attribute that success to? I mean, obviously you're a stud, but what specifically?
It's obvious I surrounded myself with a lot of good people, a lot of great managers, a lot of great agents there, and we focused a lot on Medicare. We did a lot of training, a lot of we emphasized it. I wanted my agents, because our retention rate was a lot better than the average agency, and probably better than any agency in the company. And I think the reason that I really focused on Medicare is because of the residual income. And because once a person, they start making $1,000 a month of residual income, and then $2,000, $5,000, and $10,000, and
Yep.
$15,000 and $20,000, et cetera. Those people they become the 8% part.
Yeah, they
part of the
stay with
8%. And to where if they're selling, just products that didn't pay residual income or paid very, very, very small residual income, they were having to hunt hard every month. And on the Medicare world, you don't have to. You still want to hunt hard every month, but you're still getting paid.
If you
every
get
month,
sick
so.
and have to take 2 weeks off, you're not devastated.
Exactly,
You know what I
because
mean?
that residual income it's the best residual income of any product line out there.
And it sounds to me like you don't really have to take too big of a short-term hit either. It seems like there's a decent year one payout also.
There is, and you need to be productive, but you can have your income can double each and every year. And first year, second year, there's no reason for it not to double, and then the second to third, it should double or at least 50% growth, and you probably have at least a 50% growth, basically until you get to have a large book, and then it could slow down a little bit, but you can grow fast, real fast.
So you've settled into Medicare, and you don't plan on going anywhere else. That's the spearhead.
No, there's not a chance.
Yeah, and the reason is residual income. Is there any other benefits that you feel that you love about Medicare specifically?
Obviously, the residual income is tremendous. I absolutely love. I love the Medicare world just because there's so many people out there, seniors that are confused about Medicare. When they enter Medicare, they're not sure. What do I do? When do I do it? How do I do it? Who do I do it with? What plans are best? And I love helping seniors. I love the idea of just really sitting down with them, making sure they're on the right plans. And we go to extreme amounts of time just to make sure they're on the right plans. But when we do that, we don't lose people. You know, I've got at least a 99% retention rate with my Medicare clients. It's 99 point something, and it's just because they know I truly have their best interests at heart. They know I know Medicare.
So let's unpack that just a little bit. So it's one thing to say I take care of my customers, but what does that actually mean from an operations perspective? What do you do?
So the very first thing we do is whenever we're in front of a client, the very first question I ask them, I need a list of your medications, your prescription drugs, and I would never make a recommendation to a client without a list of those medications. I just wouldn't do it because I feel like I'm blindfolded and I'm trying to hit a dartboard, and I'm not very good at darts to begin with. But you blindfold me, it becomes worse. And so I need a list of the prescriptions, and if they decide to go with the Medicare supplement, I'm going to see which Medicare supplement plan is the best for them. We talk through benefits, and we always sell. 99% of the Medicare supplements I sell are Plan G, and the reason I sell Plan G is because a lot of agents will sell Plan N. I don't promote Plan N. Wouldn't want to sell a Plan N unless absolutely the client. That's the only thing they requested, and the only reason being because it doesn't cover the Part B excess charges. And if that client ever gets cancer or something of that nature, then it could limit where they could go to the doctors at.
Okay.
Because cancer facilities, a lot of times they accept Medicare, but they don't accept Medicare assignments. Like for example, MD Anderson in Houston, Texas, which is one of the U.S.'s largest. So that's one of the so Plan G is where I would go to, but then if they buy Medicare supplement Plan G, then they've got to have a prescription drug plan, and that's where I need a list of their prescriptions, what pharmacy they use, and I'm really going to dive in to make sure, because I want to be able to show the client exactly what they're going to pay per prescription each and every month. I want to be able to show them if they ever leave the initial coverage stage, if they ever go to the coverage gap, which is called the donut hole, or if they ever go to the catastrophic stage. I want to be able to show them exactly what stage that they go to. And so we've got a process. It takes a little longer, but again, it's the right thing for the client.
It's good.
And then if the client wants to go Medicare Advantage, if they're considering that route, which we sell about 50% of what we sell is Medicare Advantage, about 50% is Medicare supplements. If they go Medicare Advantage, prescriptions are hugely important. And then also the next question I'm going to ask them is, what doctors, hospitals do you use? I want to make sure that the doctors, hospitals they use are in the plan's network, because those are network plans. And then we get into, what's important to you. Is dental important to you? Is vision important to you? Is hearing important to you? And if they tell me, yeah, dental's important because I've got to have, I need dentures, then I'm going to possibly guide them to a plan that covers a big portion of their dentures.
Okay.
Or if they say I need hearing aids, I'm going to guide them to a plan that does great on their hearing aids. So basically, I'm going to talk to them, ask them questions, and by that, I'm fact finding to find out what plan is best for them. I'm never going to just sit down and say, hey, plan X is best for you, because there's not one size that fits all.
Yep.
So.
Yep. Totally agree. So do you feel like you're in the minority taking that approach, or is that kind of what a lot of people are doing, or what separates you? Why, you know what I mean? Why? I don't hear that very often.
I'm definitely in the minority, and I probably and I say I grow slower. We've grown extremely fast just because we see a lot of people and we get a ton of referrals because of the process we take. But a lot of people are just doing it over the phone and so forth. And phone is fine. There's nothing wrong with that at all, as long as you're still following the same process.
Yeah.
You know, what I hate to see is an individual enrolling them in a Medicare Advantage plan, but never asking what their prescriptions are, never asking, you know, who their doctors are, what hospitals they use, and just making sure that's the best plan for them. And so regardless if you do it in person or over the phone, take the time just to do it the right way and make sure the person fully understands what they're getting and understands, you know, their doctors are covered, their nurse, you know, their prescriptions or how they're covered, et cetera. So
interesting. So without sharing any details you're not comfortable with, just help them understand maybe the size and the scope of your agency. Are you able to talk about any sort of that stuff?
Yeah, when I started Secure back in February of 2014, we started with myself and 4 agents, and you know, just now in what is this 5.5 years later, and we had no client base whatsoever. So you know, in February of 2014, we sold our first client, and now we have over 750 agents. It's closer to 800 agents now, and I started selling back in 2014, and in my personal book of client business with Medicare just broke 2,000.
Wow.
And 2,000 clients in the last 5 years, and so we had a lot of clients. But now I don't do any cold calling. I've never cold called. And what we do is that, you know, we do with our marketing budget, we use the Medicare seminars.
Yep.
And we do the Medicare seminars, and then it's all referrals.
That's awesome.
And then we get a ton of referrals.
Well, let's unpack those two things. The first thing I want to talk about is are you willing to share, or can you share? You know, if you were to train me, let's just say you just hired me, and you said, you know what, a big part of our business is referrals, and I want to teach you that. What would you tell me? How would you? Obviously, it's a big process, but how would you train me to your process of getting referrals?
Okay, referrals is actually very, very, very simple.
Okay,
a lot of agents never get referrals, and and I really believe referrals is one reason people. I never even ask for referrals. Never ask. I never even bring it up, and but I get probably at least no less than 10 every single week, and there's never a week that goes by I don't get 10.
Sheesh, 10.
At least 10. And the reason being is because when you treat people right and they know you took the extra mile and you do, and you really and like every year in August, every year in August, we send a letter to every client we have, ask them to update their prescription drug list because we want to make sure they're on the right plan for the upcoming year. They see those, and every year when they're in Missouri, we have what we call Missouri Anniversary Rules. So every time a person takes a rate increase on a Medicare supplement, we review that. Now, I've added staff. When I first started, it was just me. Then I added a second person. I've added a third person, and now we're up to 6 individuals, you know, helping me with my Medicare business, and because there's no way I could do it all by myself, and each person has their role that they do. But getting referrals is nothing more than the person says, hey, I trust you. I know you did exactly what was in my best interest, and I want you to help my family and friends because I know I want my family and friends to have that same great service that you had.
Gotcha.
And we go overboard on it. We send out birthday cards, and you know, my clients, when I'm with them, I take the time with them. I'm not in there and, you know, trying to rush it and be out in 20 minutes.
Yeah,
you know,
I can tell you're always so busy.
Yeah.
Every time I try and track you down, you're either in a meeting or talking to the client or you're gone.
I book
man.
every client for no less than an hour,
mm-hmm.
and I want to make sure that, you know, every client feels that personal touch and personal service. But I get a ton of referrals from my clients, and then if they've attended a Medicare seminar, I get twice as many from those individuals.
That's interesting. Well, that's where we're going to head next, and probably live there for a minute, because our audience knows that I'm not a licensed insurance agent. I'm not an insurance producer. I'm the marketing guy. Cody fills that seat, and you sort of started it all, you know, and so Cody's learned a lot from you. And you do something that's very interesting that a lot of people do, that I'd like to spend really a decent amount of time talking through, and that's the seminar model. Mm-hmm. So would you mind I know you just went through one this week, right?
I did.
Okay.
I did 2 seminars yesterday here in Springfield.
Okay. And so walk me through. Okay, so your marketing budget is how much for the week?
So anytime we do a Medicare seminars, marketing budget is always $5,000.
Okay.
And that includes putting, attendance, getting people there.
Yep.
And that also includes the food.
Okay.
And so that we typically get 4 seminars out of that 3 to 4 seminars out of that budget, depending on where we're doing them at. And if it's like in St. Louis, it's typically 3. Springfield, we're going to get 4 out of that budget because we're going to do 2 in Springfield, 1 at Springfield North, 1 at Springfield South, 1 in Branson, 1 in Joplin.
Okay. If
we're doing them in Kansas City, we're typically getting 3.
Okay.
And so we're mailing them because we always give the person, like yesterday in Springfield, we did one at 1:30. And we did one at 5:30, just in case people were working at 1:30 and they could attend a 5:30 one.
Yep.
And
that's 2, and that was yesterday. And then your next 2 are going to be when?
We have one next week in Branson.
Okay.
And we did one last week in Joplin.
What time is that? What time are those? I'm just curious.
The dinner ones always work better, so we try to do 5:30 or 6 p.m. Each time, and they always have a better attendance than the lunch ones.
Okay.
Just because people are working, the seniors in today's world, their full retirement age is 66, and some of them is 60, it's in the 66-year-old, and so we're trying to for Social Security benefits. So a lot of people are waiting till they're 66 to retire now.
Okay.
But they're still going to Medicare at 65, which means if they're waiting to retire at 66, then that means they're still working. And so that's why the dinner seminars always work better for us. And so we try to focus heavily on the dinner seminars. We have a new new agent down in Jackson, Mississippi that wanted to get into Medicare seminars. So I went down there last week and I did 2 events with him. I did his first 2 for him, and then he did the last 2 last week by himself. He learned from watching.
What was the attendance?
It was great. The one we did one in Horn Lake, Mississippi, and there was 69 people there.
Okay.
69 individuals there, and then we did one in Jackson, Mississippi, and there were 47 or ballpark, and 40 something people there.
Okay.
And it was really great. He got between the 2 seminars. And we give out a little survey at the end saying, yes, please contact me, or no, don't contact me. And if they mark no, we take them off our list. We're not here to chase people. We're not here to. We want to help the people that want to be helped. That's the people we want to visit with and sit down with. I'm not in the business of begging people to meet with me or chase them. There's too many other people that are looking for great help, and there's no reason to waste time on what I call China eggs. And so anyway, but he got over 100 yeses, and this is a brand new agent. His first week with us, got over 100 yeses, so he's got over 100 prospects. He called me this morning, and he's already sold 6 plans this week already. And
good for him. I remember meeting with him. Meeting with him. What was that? 2 months ago, and he was considering everything. He was sitting across the table from us, and he was sitting there just scoping it out. Should I do it? And then he came to 8%.
Yeah.
Then I had a couple drinks with him at the bar, and he's like, I'm thinking about joining Brian. I'm like, dude, there's no smarter guy than to jump on his team. I'm like, and then here we are, a month after 8%, 5 weeks, and he's got his first, it's just awesome, man.
Yeah. And then I went to Tulsa, Oklahoma the week before last, and I did 2 seminars for a new we brought on an agency there in Tulsa. And this is an agency that's very, very, very successful. They do a ton of life and annuity business.
Okay.
And I mean, they're very, very.
That's the guys I know, right?
Yeah.
Okay.
Yeah, they're very successful, but they just never have implemented Medicare into their business model yet.
Yeah.
And so they've got about 10 new agents. And I say 10 that's been there for a couple years or less. And these agents, they were kind of having a retention problem. A small retention, not a huge one, but a small retention problem, and so they called me, and they've heard about Medicare, et cetera, and so we talked, and I went up there and did some Medicare seminars with them, and 2 in Tulsa, Oklahoma, and they fall in love with it now.
Well, I mean, good grief, there's an appetite for it. Like we find that with all things that we're doing, it's like there's some of our marketing challenges that we have that are harder targets to hit because their hunger just isn't there as much, but the Medicare. I mean, there's just a lot of people that need help, and there's a lot of people that I feel like are doing a poor job servicing their book of business.
No question about that.
So if you can just come in and be like, oh, that guy is buying me lunch at Golden Corral, and he's educating me, and he's saying things like, I'm not going to chase you, whatever. Just tell me no big deal. I can see how that would resonate with the crowd.
Yeah. And what you said, one thing there is very important is I talk to agents or to clients all the time. And they're like, well, I bought this plan 5 years ago. And
I haven't talked to them yet. Again.
I've never seen the agent since. And that's probably about 80% of the time. And I don't know.
8 out of 10.
I don't know exactly, but it's got to be somewhere in that ballpark. And that's just, and I never want a client to be able to say that about me.
That's awesome.
And I've got a team now that, they may not always meet with me or talk to me, but, they're going to meet with somebody on my team.
Right on.
Or talk to someone on my team, but it's still me.
Right on.
And those individuals, they follow the exact same process that I follow.
So walk me through just real quick. So like, let's just say we talked to some random Medicare office in, I don't know, Michigan somewhere. Okay. And we were going to do a seminar structure. Let's just say we spend $5,000 to get the individuals there. And would you recommend setting 4 events, 2 lunches, 2 dinners? Back to back, or how would that work?
And so it kind of really depends. So let me kind of give you an example. So like when I do St. Louis as an example, St. Louis is a big area. It's a lot of population. And so what we'll do is that St. Louis has, and we always use Golden Corrals, and I say always, almost always, to where they've got 3 Golden Corrals in that area. And so we'll do a lunch, a dinner, and a lunch.
Okay.
Or a dinner, lunch, and dinner. Okay. Some type of combination back-to-back days. And so that way people have some options, and they're all spread out throughout St. Louis, which is obviously heavy populated area. And so our marketing budget, we don't have to go, and we always do about a 20-mile radius of where the event's at. Yeah. But now if we're in a more rural area, we may expand that radius to 30 miles or 40 miles. Yeah. But like Kansas City, same type of situation as St. Louis. But like Springfield's not nearly as populated, not even close to Kansas City or St. Louis.
Yeah.
So here we really we do 2 events in Springfield, an event in Joplin, an event in Branson. And Joplin's an hour from Springfield, and so what we'll do is we'll tell the marketing, we'll use our marketing budget. Hey, do a 20-mile radius of Springfield, do a 20-mile radius of Joplin, and do a 20-mile radius of Branson.
Yep.
And so we're spreading those out a little bit, and so there may be some areas in between we're not even touching, maybe because they didn't meet the mile radius. And but sometimes, depending on how many people are turning 65 that month and the population we're working with, we may expand that to 30 miles.
So your message is mostly turning 65 Medicare questions?
We're turning 60. That's our focus on our Medicare seminars is the turning 65, because those individuals that, they're getting hundreds and hundreds of pieces of mail from every insurance company out there, especially Medicare Advantage carriers out there. They're getting just hundreds of pieces. They're getting hundreds of phone calls unless they're on the do not call. So they're getting lots of information. But the only thing they're getting is mass confusion.
Yeah,
is what they're getting, because hey, here's my plan. Here's another person's plan. Here's another person's plan, and they have no clue what they're doing. So when we do these Medicare seminars, we're automatically going. We get so much appreciation. And at the end of the seminars, just making it clear to them, we're not pushing any company. I tell people all the time, we're independent. I don't care if I enroll you with company A, B, or C, or X, Y, or Z. I want to enroll you with a company that's best for you. And there's no one company that's best for all people.
Makes a lot of sense.
It's just not even possible.
Makes a lot of sense. So really, you feel like you've cracked the nut. You don't really plan on, the only thing I was going to talk about, but we don't even need to anymore at this point because we've had such a good conversation. I was going to talk about AEP for just a few minutes, if you don't mind. So we've got some, it's hunting season, right? Coming up here in a little bit. Hunting, maybe hit poor word choice, but it's a lot of fish are biting. Let's put it that way. You've been through how many AEPs at this point?
This would be my 6th one that I've done, by myself.
Okay.
Because I was with Mutual. We went through AEPs, but it was just different. But this is the 6th one as me, as a producer.
Okay. So if this is your 6th one, we're coming into 2019. What are you doing different this AEP than you did the previous 5? Is there anything?
Yeah. We improve our process each and every time. And so what we do, and it's crazy thing is, I get referrals now. I get a referral this week from Alabama, from Texas, and these are, and I have to do these over the phone, but we still follow the same process. Yeah. And so regardless of where it's at, the process is the same. And but like for example, we mail out every person a letter in August asking them to update their prescription list. Yep. And they return those. And then October 1st, when the new plans hit the system, whether it be Medicare Advantage plan or prescription drug plan, we start, and you cannot enroll anybody till October 15th. So we got 14 days there, and we work a lot of hours in those 14 days running every single person to see if they're on the right plan or if
in your current book, that is?
In my current book.
Okay.
Just, to see if we need to change plans, or if the right plan is the plan's the same, or is it still the best for them. There was a client. I'll tell you one quick story, and this is why it's so important to review the prescription drug plans and the Medicare Advantage plans. I had a client, and not a client of mine, but a client of another agent's. In January, called me. She was referred to me by another client. She calls me and she says, Brian, she says, I need to visit with you. I've got a real problem. And so she comes into the office. She's local here in Springfield, and she says, I've got this prescription. I've always paid $40 or $50 a month. And she said, last year, I think got close to $60 a month. And she said, I bought this plan 6 years ago, but I've never heard from my agent since I bought the plan. And she says, I go to the pharmacy this year, and the pharmacist asked for my new prescription drug card, and I give it to him because you get a new card every year, whether we even stay on the same plan. And she says, I gave him my new card, and he says it'll be $600 and whatever for the prescription.
Good grief, man!
And that's about her reaction was, but hers was tears.
Yeah, showstopper.
And so long story short is that. If somebody would just reviewed her plan, the plan that she was on discontinued they removed that particular drug from the formulary. If someone would have removed, or if somebody would have reviewed her plan, they could have easily got her for $40 or $50 back, put her on the right plan, and it would have been copay of $40 or $50 instead of this year she's paid over $600 every single month.
And she paid it?
She has no choice. Her son and daughter is helping her pay it. She has no choice because she was out of, it was in January she found out the election period ended December 7th.
Sheesh.
So just and that's the kind of harm that you can put your clients in if you're not reviewing it each and every year. The clients, they're relying on us to do what's right and to take care of them. And I take that very personal, and I take as a huge responsibility to make sure that all my clients are on the right plans.
Well, that right there, I mean, even that's awesome. I mean, good for you guys,
So,
it's exciting.
We take a lot of time, but, a lot of people say, well, why do you take that much time? Well, that's the reason.
Okay. So in terms of like coming into this year's AEP, anything else that you're kind of doing different as a point of emphasis with your team? Yeah.
So this year we're doing a couple things. Number one is we're holding a client appreciation.
Oh, cool.
And so every client's invited, and we're doing a breakfast at the Bass Pro Shops.
Cool.
At their restaurant there. And so we've got hundreds of clients registered for that. And then another thing we do is we do client meetings. So, for example, all the clients with Carrier A, we're having them all come in.
Oh, I see.
Client Carrier
cool.
B, and
come in here or
no, we have it at a remote location.
Wow.
And we have they all come in that way, have groups of them and kind of go over the 2020 changes, and some of them we'll tell them that, hey, you need to, we'd still like want to come to the meeting, but based on your prescriptions, this other plan's going to be better for you.
Yeah.
So we do a lot of that pre-work. So when they send us our prescription list back, so there's a lot of work that goes into it.
That's awesome.
But it's really, really good.
That's cool. So, well, dude, is there anything else? I mean, if you, a lot of our audience is younger, honestly. Mm-hmm. Is there anything like just one little word of wisdom you would give to a young individual that's just now starting AEP or starting Medicare, or considering getting into Medicare, or considering getting into insurance?
Yeah, the biggest thing, if you're going to get into Medicare, you really do want to do and need to do Medicare supplements, Medicare Advantage plans, both, just because some people are going to be best on Medicare supplements, some people are best on Medicare Advantage plans, but also you want to learn to really cross-sell too. Because for example, if they take a Medicare Advantage plan, give them the option, show them the hospital indemnity plans. It helps cover their copays for the hospital stays, and and then the number one reason that people hit their max out of pocket on Medicare Advantage plans is cancer. So show them a cancer, heart attack, stroke plan. And so sell some extra plans, some dental, vision, hearing plans, and some other plans. Like, for example, if they buy a Medicare supplement, we're going to show them a dental and see if they're interested. I'm not going to pressure them at all. Just, hey, is dental an interest of yours? And you'll be so surprised of how many people are losing dental on their group insurance when they come off their group, or losing some employee benefits that if you don't bring it up, they don't know that you sell it. And that's why it's so important to discuss other products with your clients.
Well, that's awesome. Well,
life insurance, they lose the term life insurance that they had at work. It was only part of the group, or things of that nature. So just mention those products. You don't have to. I'm the probably the softest closer that's ever been in the insurance industry.
Yeah.
But I still close 99% of the people I get in front of.
That's awesome.
But it's not because I'm pressuring them in any stretch of imaginations. I still think the best way to make a decision is to be informed, and that's what I do. Is we inform the people what their options are.
I got a question you may have never been asked before. Do you ever walk away from business that people just red flags come up in a meeting and you just say, no thanks, I don't think we can work together, or present them options that cause them to go away?
I've done that a couple times. It's only been a couple times, but I have done that. 99.9% of people I'm going to be able to work with.
Yeah.
But there's been a couple of times. I had a life insurance thing to where I'm pretty sure there was some red flags there for some anti-money laundering.
Yeah.
And I walked away from that business, and I still remember that situation.
Jeez.
And then on the Medicare side, I've not had that situation yet, but some of the clients can be more difficult, but once they kind of see that you truly have their best interest at heart, they typically come around. So.
Yeah, that's awesome. Well, Brian, dude, I appreciate you joining us. I know you this is a really busy time for you, and you scheduled it out. Obviously, I probably wouldn't have got this meeting if I wasn't your son's business partner. So I appreciate that. Looking forward to really just kind of watching you guys grow this AEP. I learned a lot, man. I always love these conversations because it helps me be better at marketing. So, and guys, we also do obviously help with seminar marketing as well. If you ever are interested in talking through that, I think I can get you some help that way. So, man, thanks for joining us.
You're welcome.
I appreciate your time, guys. Have a great afternoon. Good luck with this week. Be productive.
Thank you very much.